What does it really mean to be healthy? To explore that question, we sat down with one of Asia's leading CEOs and the chief coach of Mega We Care, Mr. Vivek Dhawan.
Whatever it is, to eat right, to sleep well, we have to make that effort on our own.
In this conversation, we uncover what healthy living really looks like and whether the answer has been right in front of us all along.
I think this is serious, man, because look around. I mean, look in your own homes, look at friends you know, look at the countries you travel to. Name a place where this is not growing. If we are getting richer, but are we getting healthier? That's the big question. And if it was the case, then you would find healthy people all around the world. But that's not true, right? It's not true. You have more diabetes, and that's why you see the boom in GLP-1s. If people were not fat, you wouldn't have weight loss programs and weight loss businesses around you. So it's been happening for a long time. It's not happened over the last 1 or 2 years. I think this is a change that we have seen over years. Food, exercise, lifestyle has changed. I mean, we have become more urban. We live a very stressful life. And that's the way life is. So, and we all put on weight. We do less exercise. We are busy at work. We have families to look after. I mean, it's not you. It happened to me as well. So I think it's so common that we forget the most important thing in our life is health. And we are busy running, earning, fighting to survive and do all those things. And then we are blessed with all this great food around us, which is very tasty. We enjoy it. And some of us get affected by it. You know, we put on weight and we also catch on diseases. And one of them is diabetes. The other one is heart disease. You look at the biggest rates of death in the US, it's probably heart disease after accidents. And we're also eating a lot of processed food. That's also causing this weight epidemic. And with all this happening, I think, what are the options? The options are get the disease and then take the drug. And if you have the disease, you have to take the drug. I mean, I have heart disease and I do take some statin as well. But then there's also a choice. I mean, can you make a difference yourself? I mean, can you modify and change your lifestyle? You know, can you bring changes to the way you live your life? And I think there is a way you can make that effort. And that includes a couple of things, right? What is lifestyle changes? Lifestyle changes includes what? You eat right. What's right? I mean, there are a lot of questions. Is it plant-based right? Is keto right? So there are different types of diets people live in, but there is enough evidence today in this world to show that the Mediterranean diet or a healthy, unprocessed food, whole food, plant-based, highly plant-based, fruits, vegetables, unprocessed, food is healthier for you. Containing fiber is healthier for you and helps you to ward off disease. Recently published studies on cancer trials happened, and they also showed how smoking, how diet is one of the biggest risks in creating cancer. So I think there is a way that we as human beings can also have a role in looking after our health. We should make that effort ourselves. And that's why at Mega we run programs like Good Health by Yourself, where we help people to take health in their own hands and make an effort, at least make an effort to make changes in their life. So that's where it's all coming from. And I think it's important because you not only help yourself by staying healthy, that's one. You help your families. I always keep thinking that imagine I was old, I don't want my children to spend time taking the dad to the hospital every day and helping me out. So I free them up. It costs a lot of money getting treated, so I save me and the government some money as well, because sometimes governments fund all the treatments as well, and there's a lack of capacity in many hospitals. There's not enough facilities available. So from many ways, I think if we at least try on our own to make an effort and make a change in our lifestyle, it could reduce the burden of disease and it could help us at least stay healthy as long as we live. I'm not talking about longevity. I'm not saying you're going to live 150, but as long as you live, you stay healthy. I'm sure Ayurveda and the Chinese medicine philosophy, you see, a dose of prevention is better than cure. So historically, the father of medicine, everybody talks about, food is thy medicine. So always the beginning is first to prevent disease. Right? Yes, cure is when you have disease. When I was growing up, I thought I was healthy. I used to exercise, play a lot of sports. But as life became very busy and I got busy in work for about 30, 40 years of my life, I forgot all that and did everything I shouldn't have done. Eating late, sleeping less, working more, smoking, and all these things I did. And I forgot that I also had a responsibility to look after my own health. I think we should start teaching our children very early that health is very important and they have to take responsibility. That includes eating right, as I said, that includes exercising, that includes sleeping well, and that also includes not smoking, and that also includes all the other good habits that you can inculcate in yourself. And living a healthy life where you have good friends and you relate to the world you live in, and makes you a happy person and you enjoy life in the right way, giving you and the world around you a chance to blossom. So we as a company, we are in the medicine business, and one would believe that we would be happier that more people fall sick and we would make more money because we could sell more medicine. Yeah, but I think that's the wrong prayer. If I get up every morning and pray for more sickness, then I'm not doing what is right for this world. So our prayers are to help people stay healthy as long as they live. So we run program within the company, we run it outside the company. We try and educate people who we touch, people who we work with, to help them at least understand that there is this possibility that they can make a change. They can make the effort. It's not always easy. There are a lot of temptations. Your lifestyle doesn't allow, and it's hard to change. But if you realize that your life is going to be long, and today people live, I think the average age lifespan has grown to what, 74. I've seen a lot of people around me who are living 80, 85, 88. It's quite normal now. And if you live your later part of your life with disease, it's a lot of burden, not only to yourself, but your family around you. So doing something about it early, making a difference to your own health, I think is very important. So we have taken a decision to educate and bring knowledge, true knowledge that we believe is not something that involves selling a product. It's about telling you what we hear is scientifically proven, clinically tested, tried, and there's sufficient evidence to show that people who live that kind of lifestyle enjoy a healthier life. We have been trying. We actually run a wellness center in Thailand, which is about 160 kilometers away from Bangkok. And we have a cardiologist who lives there. He's a chief wellness officer. And we help educate people to learn to eat right, to sleep well, to exercise. People who come with various kind of ailments, heart disease, diabetes, all the other different lifestyle-based, we call NCDs, non-communicable disease, not infections, and they come and spend time with us and we help them to improve. I'm not saying that we cure them, but we help them to improve and maybe feel better, live healthier. And over time, we've been doing this for the last, what, 6 to 8 years. I think in Thailand, we've been running this center. Um, and we do a lot of work in educating pharmacists and medical professionals as well, so we can take this message around to people in the country. And we've started these programs in some other countries as well. We have launched in Sri Lanka. We have also launched this program in Peru. And we are also building to launch them in other countries where we call Wellness We Care is our center. And based on this, we are running programs around the countries where we operate in. Very independent of what we do our business. We also sell pure medicines for similar disease. We also sell health supplements. Complementary medicine, as we call what is required for diseases to manage your disease that you have, along with the disease you have, helps you to manage the side effects of your disease. But at the same time, we also run programs along in the countries where we are to help people make lifestyle changes. So one of the best ways, I think, to reach out to a larger group of people, so it's easily accessible and it makes it much easier for them to join, to learn, is why we have just started an e-learning program, which is called e-health, e-wellness, based on good health by yourself, where people can join online and learn and make those changes in their own lifestyle, scientifically based and not very difficult for them to understand. And they can use this program to try and encourage themselves to make changes in their own life. And hopefully, I mean, if people join and they can make those changes, and they will see some benefits in their life, and small improvements can improve their health, and they can feel good, feel better. That's the objective, and this is something that we have just launched, and we plan to continue doing that in many of the countries where we operate. Personal habits. I mean, I had few bad habits I developed over my life. I've had this belief in my life that I have to first of all believe that this is the right thing to do. So I used to smoke, but I was only smoking in the evenings, and one day I decided that it's not the right thing to do, and I believe that it is not good for my health. Though we've read about it, we have heard about it, we thought about it, but it was very nice to smoke every day, in the evening after meal. And I just gave up on the 16th of July, 2012, and since then I have not touched it again. So I think once you believe, you make that change, you give up. I had heart disease. My father had, but he lived till 88. So I also one day thought about health. I used to read because I'm in the health business. So I learned that one of the best ways to stay healthy is to change your diet. So I was eating, living in Thailand and traveling around the world, I was eating everything, you can think of. Then one day, after listening to a lot of people, I believed, I gave up eating meat. I gave up dairy. I gave up oil in my diet, and I became, people say vegan, but not vegan, plant-based whole food. So I started to eat whole food. So I mean, these are things that what are difficult, but I think the most important reason I could make this change was because I first believed that this is right for me, is the right thing to do for my health. I'm not doing it for anybody else. And if I wanted to stay healthy as long as I live, again, not to live long, but to live healthy, I made that change. So these are hard decisions. These are not easy to do because there's so much temptation around you. And I get asked this question all the time. Don't you feel like eating some meat sometime? Don't you miss your milk? Yeah, I do, but I don't anymore. So it's tough. But once you believe, you make the change for the right reason. Yeah, I mean, that's a very difficult question because life is busy, correct. After you finish education, after my engineering, my MBA, you get into a job and then you get very busy. You get married, you have children, and life is very, very busy, man. Morning to evening, nights, days are busy. And then work keeps you busy and you forget everything else. You don't think about health, you don't think about food, you don't think about diet. So it is a very difficult question. How do you decide that you should make that change? Either you have a shock, you get disease, but that's probably sometime very short lived because after that you have two choices. You can live on medicine and do nothing about health. That's also possible. And some of us will also say, I'm bad, my bad luck, my genetics are bad, so what can I do? So do nothing about it and carry on with life as it is. But that's also an option. So it's a very difficult question. I think we have to ask ourselves because we will live. with medicine, with surgery, with all the other support for a long, long time of our life. And I think, as I said, the average age is 74. And I know my two parents lived till 88. One had heart disease and the other had high cholesterol. They also lived with medication, with all the other things in their life. But looking at them and asking myself as I get old, today it doesn't matter, as I get old, the amount of medications I take, the amount of help I need for my children, and I've become a dependent with all these kind of disease. Should I be doing something about it now? I think that's a question which all of us have to ask ourselves, that we live reasonably long now. Our lifespan has gone much longer. And till the last day of my life, of our lives, do we want to be independent, walking on our own, not being helped around, not being dependent, not being a burden on anybody else? And if we don't want to do that, don't want that to happen, I think we have to make an effort on our own. Is there a guarantee that you will be healthy? Maybe not. You may still have disease, but at least we owe it to ourselves. We have to make that choice. We have to make that effort on our own. Whatever it is, to eat right, to sleep well, at least try to sleep well. I mean, there's no magic for it, but if we exercise regularly, get tired, have a good mind, have a happy life, I think we sleep well. If we eat well, exercise daily, have good friends in our life. I mean, I've read Blue Zones and I've met Dan. I've read a lot about the Maui culture in Okinawa. Women live till 103, 104. We have good friends around them. They still eat very healthy. They walk every day. And as long as still 100, 304, they're active. Their brain are active. They're still moving around. And there are many places like Sardinia and even Loma Linda in California, which is a Seventh-day Adventist township where people have good friendships and they walk, eat, and live healthy till they're alive. So I think we owe it to ourselves, and it's possible. It's possible. At least we should make the effort, even though it's not guaranteed, but there's a good chance that if we make the effort, we can live healthy as long as we live. So this is my belief, and this is our belief that we are promoting to the world around us, that stay healthy as long as you live. And this is on you, depends on you. Make the effort. Good health by yourself, it's in our own hands. So we have to make the effort, and we should make the effort.
Mega, we care.